Thank you for joining us on our COVID-19 Patients and Family Perspectives. Today we will be exploring the visitation policies of hospitals and how that may affect you as a patient or family member. While the Centers for Medicaid and Medicare Services, known as CMS, provided emergency guidance to nursing homes in mid-March, they restricted visitors, volunteers, and non-essential staff. Hospitals, on the other hand, uniformly adopted visitor restrictions as a means of protecting their staff and patients, while also protecting visitors in light of the asymptomatic virus, COVID-19. Some hospitals allow a visitor for end-of-life compassionate care as long as the patient is not in a COVID unit and is screened upon arrival. Others allow a partner to be present during delivery, and some allow a parent or guardian to be present for a pediatric patient, whether it's during a surgery or procedure pending. The visitors are given passes, they're screened, and they're confined just to the patient area. They can't go outside of the patient area. One expects these restrictions to continue until COVID-19 cases are dramatically reduced, or as we all hope, a vaccine. Even the president's plan for reopening businesses, parks, and on, has visitation in the final tier for opening up America. I am joined by Rosie. Rosie Bartel is a wife, mother, grandmother, and an educator. In August of 2009, she underwent a total right knee replacement that developed into a MRSA staph infection. This infection led to amputation of her right leg, hip, and part of her pelvic bone. She wants a world without serious infections. Rosie believes that this cannot be accomplished without patients sharing their personal experiences, as she will do today, that can drive patient and family outcomes in the future. Rosie, thank you for being with us today. Our listeners that don't know you, maybe you could briefly explain how you became involved as a patient and family advocate.
I became involved as a patient family advocate through the hospital where I had my initial knee surgery. They asked me to be part of a study group because they were having lots of infections and wanted to control them. And from there, IHI, Institute for Healthcare Improvement, asked me to do a video for them. And so that video is available through YouTube. It's called One is Too Many. And that has been my mantra through all of this. And I have continued to tell that for the last 10 years, that one infection is too many. One person suffering from any type of infection is too many, because it is devastating to the person and to the family and even to the community. So that is why I've become a patient advocate. I think my background in education has pushed me towards it. And, storytelling has always been one of my fortes. So telling my story came easily, and using it to help other patients became part of my plan.
Well, thank you, Rosie. It helps for us to better understand also your role in patient advocacy. Rosie, if you or a loved one would need to go into the hospital today, how would you best prepare yourself and your family so you can stay in touch with each other?
At any time, any one of our loved ones could end up in the hospital and in isolation and away from us. And so I've been encouraging them to make sure they have their phones and their iPads up to date, that they have all their phone numbers in them, that they have all kinds of contact information, and that they're ready to take them with them if they go to the hospital. I also encourage them to keep in constant contact with each other during this time of isolation, because it's real easy to find yourself alone and not knowing what to do. And so the more you can keep in contact with each other, the more you can help each other prepare for a possible hospitalization, the better off you are.
I think one of the most challenging parts of being in isolation or quarantined at home is the pure loneliness or depression. And I'm sure it's that same way that patients experience right now in the hospital during this COVID-19 pandemic. Is there any way to prepare a patient to deal with these feelings?
Because I've experienced this several times myself over the last 10 years, and I've been in isolation for more than 30 days multiple times, I find that the best way to prepare themselves is to have those ways of communicating with the outside world. Make sure you have things that with you that you like to do. If it's crossword puzzles, if it's reading, anything that can help you pass the time. Because during that time of isolation, you need to be able to pass the time. The other thing is that you need to be prepared for the possibility that you may not feel up to doing anything. You might feel just plain alone and unable to even open up a book or open up your iPad because you're just too worn out. I don't think that sometimes people understand is that when you are sick, sometimes even opening your phone up and looking at your Facebook is too much for you. You want to just like pull the sheets over your head and let it be left alone. But yet you need to find time to communicate. You need to find ways to communicate. And that is so key to your healing. If you can't find ways to communicate, healing is gonna take more time than you want it to be.
Most hospitals, they have social workers as well as mental health professionals. Would you suggest that they also ask to speak to one of the professionals there?
Yes, I think they need to be asked to speak to professionals, and I'm hoping that hospitals are providing those on a regular basis. Most places are, like the minute you enter a hospital, within the first day or two, the social worker will come in and talk to you. And usually they're starting to plan for discharge, but in these cases, that's not going to happen real fast. So they have to plan for how are you going to cope with being there for a long time in isolation. Think about the size of a hospital room and about being in that hospital room for a long period of time. They're saying most COVID patients are there for about 10 to 30 days. That is a long time. And to be in one room, even though you have people coming and going all day long, and you still are in that one room. And I know what that feels like. I know how that starts working on you. And so you need to start communicating with the people that come and go, the social workers, the nurses, all the healthcare providers. I always knew more about their families than probably anybody else because I always felt that they were my connection to the outside world. Don't be afraid to talk to the person that cleans your room. They might be your best connection to the outside world.
Thank you, Rosie. And being in the hospital, one of the things is people like to stay and maintain their control of their decision making. So how should a patient go about making sure the physician and the hospital team are letting you, as the patient, make these decisions?
Well, I'm a big believer in co-design and that you need to be part of your hospital decision making. First of all, never let anybody say this is the only way that things can happen, but ask what are your options? What can you do and what are the possible ways of handling this? So many times a physician might say, well, this is what you need to do. And you need to be strong enough to say, wait a minute, I need to have all the options. The other thing is make sure that even though you're hospitalized and you can't have anybody with you, make sure when you're on that visit with the doctor, you connect with somebody that's your caregiver or a family member who can also be listening in, because you need that advocate. You need that person who's going to speak up for you. You know, I never realized how important that was to me until the first time I was on a ventilator. And I was on a ventilator for, 6 days. And in those 6 days, I couldn't speak for myself. And I was, my caregiver was my voice. And that, my husband is my main caregiver, and he was my voice. And he'll tell you that I spoke volumes to him with my eyes, but nobody else would have known that I was speaking with my eyes, but he did. And so even though you may not be there physically, I think you can be there through other means, especially like televisits and Zoom meetings with the physicians at the same time, so that decisions are made in connection with you, not for you.
I know we're trying to encourage anyone that's 18 years and old to have advance directives. We know that very few, though, have advance directives, whether it's a living will or healthcare power of attorney. And yet this is the way for your wishes to be carried out should you not be able to speak for yourself. How would you encourage other patients and family members to have advance directives?
My personal story was that until I was in that coma for 6 days, I didn't have an advance directive. And when I came out of the coma, that was the first thing we did. When this whole COVID virus thing started, I said, this is the perfect time to start having those conversations, and having them with your families, having them with everyone. It is a conversation that's hard to talk about, but you need to have them, because your wishes will not be met if you have not looked at those things. If you look at my living will and my advance directives, they're very detailed. I mean, I have certain wishes I want, and I have them now written down, very detailed, so that my husband will never be in a situation where he has to fight for my rights as a patient. That living will gives you power that you may not have otherwise.
The living will and the healthcare power of attorney, which your husband has, are really critical, because you're right, patients that are in the hospital right now with COVID-19, no visitors are allowed, even family members, but they do have to contact the healthcare power of attorney, the one who has that right. And they do have to have communication with them. So you're right, it's a very valuable tool.
I think that tool will then help you stay connected with your loved ones, because it's there for them to help you have your wishes fulfilled. It's just critical that you make those details. Don't be afraid to write between the lines and say, this is what I want. These are my expectations. This is what this is my end of life requirements. We never know when it's going to be our end of lifetime.
Thank you, Rosie, for your valuable insight and your sharing of your lived experience, because I think we all are hearing loud and clear the importance of communication, not only with the providers, but also communicating ahead of time your wishes and desires. I think we got your message, and now that planning ahead is important for communicating with family while you're in the hospital, but also how best to make your wishes known. Is there anything else that you'd like to add before we close?
I think that, this time is critical for everyone to step back and look at how they're prepared for a hospital stay. It may not be COVID-19, it might be something else in the future, but how well are we prepared as a patient? We hope our hospitals are prepared for these kind of emergencies, but we as patients have responsibilities to be prepared too. And so this is the time to look at how are we prepared, and how are we going to handle a situation like this when it comes up in our life.
Thank you, Rosie. And thank you for really sharing your experience, because I've learned from it today, and I've enjoyed talking to you.